going to close the door for privacy. Hello, my name is Amber. I'm going to be your nurse today.
Hello.
I'm going to go ahead and wash my hands. Okay, I'm going to have you state your first and last name for me.
Addie Caddick.
Okay, can you state your date of birth?
June 23rd, 86.
Okay, do you have any allergies?
None that I'm aware of.
Okay, any pain today?
None.
Okay. Patient has no obvious signs of symptoms. If she did have any pain, I would ask her to rate it 1 to 10. Can you tell me what day it is?
Monday.
Okay. And where are you?
Living room.
Okay. And why are you here?
For a head-to-toe assessment.
Okay. Patient is ANO times 4. She appears her stated age. Her mood is corresponding with her affect. She looks comfortable and pleasant, somewhat. Patient is well-groomed. She appears to dress appropriately for the weather. No abnormalities, no body odor noted. Yeah, so we're going to go ahead and start the head-to-toe assessment on you.
Okay.
So we're going to start at the head. So hair is thick, clean, no abnormalities noted. I'm going to be checking for lesions. Okay. No lesions noted. Skin is warm and dry. Color is appropriate for ethnicity. If there were any lesions, I would do the ABCDE, asymmetry, border, color, diameter, and elevation. But as I said, none noted. So we're going to go ahead and observe her face. It's symmetrical. No drooping is noted. No abnormalities. Turn over a little bit. No abnormalities. I'm going to have you smile for me, and I'm going to have you puff up your cheeks. Okay, cranial nerve number 5 and number 7 are intact. Okay, we're going to go ahead and looking at her eyes. They are equally dilated, no abnormalities noted. Pulling down her eyelids, checking for the conjunctiva. It is white and glossy, no pink eye is noted. Now I'm going to check her pupils reacting to light, so go ahead and just look straight for me. Okay, pupils constrict. I'm going to go ahead bilaterally as well. I'm going to go ahead and check accommodation, so just watch my pen. Okay, pupils constrict equally as well. Pupils are equally rounded and reacting to light and accommodation appropriately. Okay, so we're going to go ahead and inspect your mouth. So lips appear smooth and pink. Mucosa, turn that way a little bit. Mucosa is pink and moist. Teeth are all intact, appear clean, brushed, no cavities noted. Gums are not bleeding and pink. Tongue is pink and moist with a little bit of white layering on top. I'm going to have you stick out your tongue and say ah. Okay, uvula is midline. Tonsils are not present. They're a grade 0. I'm going to go ahead and palpitate her carotid artery one at a time. Okay, and other side. Okay, carotid arteries are 2+ bilaterally equal. Now I'm going to check for breweries. Okay, so I'm going to have you take a deep breath, blow out, and hold it. Go ahead. And again. Okay, no breweries are noted. Checking her fingernails, so they appear clean, no dirt, no clubbing, no cracks. I'm going to go ahead and have you squeeze my fingers. Okay, strength is bilaterally equal, strong. Capillary refill is 1 to 2 appropriate. I'm going to go ahead and palpitate the radial pulse. Radial pulse is 2+ bilaterally. Brachial. 1 plus bilaterally. Okay, and then we're going to go ahead and listen for her heart sounds. So what we're going to do when listening, we're going to go find the second intercostal space on the right hand side, and that's going to be for the aortic, so listen to that. Pulmonic is the second left intercostal space. Erbs is the third intercostal space. Between the fourth and the fifth is the tricuspid. And the fifth intercostal space is the mitral. Mitral we're going to listen to for 60 seconds. So now that we did that using the diaphragm, we're going to go ahead and do the same thing reversed using the bell. So, mitral, tricuspid, erbs, pulmonic, and aortic. S1 was heard best at the apex, and S2 is heard best at the base. No murmurs noted. Heart sounds are normal. I'm going to go ahead and start with lung sounds. So, going to have her take normal deep breaths in for me. I'm going to do it anterior, lateral, and posterior. So, and then I'm going to have you lift your arms up a little bit while I do it laterally. And other side. Okay. And have you turn your back a little bit. Posterior. Keep taking those breaths in and out for me. Okay, all load sounds are clear, no cracking or wheezing was noted. AP diameter is 1 to 2. Okay. We're going to go ahead and actually I'm going to have you just bend. So I'm going to check your spine alignment. Okay. Do you feel any pain?
No.
Okay, no tenderness is noted on the spine. I'm going to check your kidneys for CVA tenderness. Any
No.
pain?
No.
Okay. I'm going to have you lie back and we're going to go ahead and examine your abdomen. So, lifting your shirt up, I'm looking at it, color is appropriate for ethnicity, umbilicus is centered in midline, contour is flat and rounded. There are no scars, no rashes, no mass. So we're always going to start in the right lower quadrant, where the appendix and the cecum are. We're going to go up to the right upper quadrant, where the gallbladder and liver are, and then moving into the left upper quadrant, which is stomach and the spleen, and then left lower quadrant is descending and sigmoid. So I'm going to auscultate. I'm going to be checking for bowel sounds, making sure they're active. If they are not active, I'm going to be checking and I'll be listening for 5 minutes. And this is using my bell. Okay, bowel sounds are active. Now I'm going to percuss. Okay, Tiffany is heard everywhere besides the spleen and the liver. Now I'm going to palpate, checking for tenderness, so you just let me know if you feel any pain after we're done.
Okay.
Any pain?
No.
Okay, no tenderness is noted. I'm going to have you put your shirt down And as she's coming up, I was checking for her jugular vein dysfunction, making sure there was no bulging, there's no abnormalities noted. So then going, turn that way a little bit. No.
Oh, I'm sorry.
Going into lower extremities. So again,
Oh, okay.
skin is appropriate for ethnicity. Skin is warm and dry. Checking the ankles. So no redness, no swelling, no cracks. Skin is warm and dry. No abnormalities, no edema. I'm going to have you lift your feet up. Checking the Babinski. Okay. And negative Babinski. I'm going to have, I'm going to check the Duralis pedis. And that's 1+ bilaterally tibial. And that's just going to be in here. And that's 2+ bilaterally. Okay, I'm going to have you stand up. We're going to be checking the Romberg test. So I'm going to be walking with my patient there and back. And I'm just making sure. Okay, we're going to walk back. Okay, steady. I'm going to have you stand, close your eyes for me. Keep your feet together. Okay, she is standing appropriately, very steady. A little bit of sweeping, that's normal. We're going to go ahead and have C. The Romberg test was negative. That is completing your head to toe assessment.
Thank you very much.
Thank you.